Hi, my name is Katie Booker, and I'm a rising junior at Susquehanna University. This summer, I worked with Dr. Nick Ungsten, investigated the relationship between perceived stress and local community identification during the COVID-19 pandemic. To begin, social identity has many benefits to psychological and physical health. Research shows that there are positive outcomes when there is a need to belong to a group. There is also an increased resilience when belonging to a group. Social identity is particularly important during times of crisis and emergency, like earthquakes and floods, as people often rally around each other for support. COVID-19 was a unique crisis as the airborne virus limited the amount of time people could spend with their social groups and communities. Masking and lockdown rules prevented communities to be with one another. We tested the hypothesis that stronger identification with your local community would predict lower stress levels during the pandemic. We were interested to see if people were able to connect socially during the pandemic, what effect it would have on stress levels. An online survey was conducted in early April 2020, October 2020, and March 2021. Participants were American adults. Local community ID was measured with a series of questions that participants read. Examples of statements were, I feel a sense of connection to my local community, and I am proud to belong to my local community. Stress was measured using the perceived stress scale, where participants rated their feelings over the past 2 weeks. Statements included, been upset because of something that happened unexpectedly and felt nervous and stressed. We regressed stress onto local community at each time point and also added control variables including age, political identification, perceived self-risk, losing income, knowing someone with COVID, and essential worker status. Our analysis showed that local community identification predicted less stress, even when controlling for variables such as having a high perceived self-risk of contracting the disease and losing income during the pandemic. Although COVID-19 made it difficult, those who were able to connect to their local community experienced less stress. Future research should investigate the relationship between familiar groups, such as your family and friends, and stress levels during the pandemic, as well as the relationship between your local community identification and mask wearing and vaccination practices. Thank you.